Hi, I'm Dr. Alison Kole, sleep medicine specialist and bona fide chronic insomniac. Welcome to the Sleep is My Waking Passion podcast. Remember, knowledge is empowerment, and if applied correctly, it can help you biohack your way to a better night of sleep, just like I did. Hello and welcome to another episode of the Sleep is My Waking Passion podcast. You know who I am. I am your host, and today I am joined by Dr. Kim Hutchison. She is both a neurologist and sleep specialist. She is a CPAP expert. She is an educator, and she is an inventor. She hails from Portland, Oregon. That is where she is practicing currently. And she has created a product called Somnaseal, which will be mentioned and discussed because it's really relevant and helpful for an age-old problem that we have that we're going to be talking about today. But this is not a sponsored podcast. I'm just talking about it because I saw that she had this product and I was like, ooh, this is cool. I've not heard of it and I want to talk about it. So we're basically going to try to hit on some really common problems that interfere with your ability to actually tolerate CPAP. So this focus for this topic today is really going to be on you obstructive sleep apnea folks or people with other forms of sleep apnea that basically need to use a machine to help you with breathing that we either call APAP or CPAP. And some people it's a little bit more complex. There's BiPAP and then there's ASV. But we are going to be talking today about how to maximize your ability to tolerate being on those machines because they can be life-saving. Welcome, Kim. It's so exciting to talk to you. Thank you. So we were brainstorming some topics for this. And one of the things is I noticed is in the themes is that we kind of hit on a lot of the same points because I'm like, all right, this matches up. Like from the pulmonary sleep and the neurology sleep, the bottom line is the overlap for obstructive sleep apnea patients seems to be pretty universal. So we were going to start, you had mentioned talking about mouth leak and dry mouth. So elaborate for our listeners, please.
Okay, so to focus on CPAP problems is a very common question for people, so it's always a popular topic. So we'll just jump right in. One of the number one problems that people talk about, and is a reason, unfortunately, for quitting CPAP a lot of times, is having a dry mouth and mouth leaks. And so I say mouth leaks because mouth leaks is usually the cause of dry mouth. Of course, you can have dry mouth if you're using a full face mask, and all of that air is also blowing through your mouth because of being a mouth breather. But patients that are wearing like a nasal or a nasal pillow mask that have dry mouth, it's almost always because the mouth is dropping open a little bit. And that could be like, really wide, or it could be just a little bit like during certain phases of sleep or even certain positions. And so you may not even be aware that you're having mouth leaks, but it may be that you're just waking up with a dry mouth, or you wake up and you can't even, get your mouth open without getting a drink of water first. Some patients will talk about that. So I kind of lump the mouth leaks in with dry mouth, whereas if we're talking about mask leaks, that's something that we'll talk about next. And that's a completely, different cause of problem.
So quick show and tell.
Yes.
So guys, nasal pillows have these little hooks that go in the nostrils over here. This is a form of a nasal pillow. Nasal masks come in a few varieties. I'm going to show you a ResMed style that kind of goes around the nose. And then you even have some neat ones where the tube is on top of the head. I'm going to show you another form where it's just kind of smooth. This is the tube in front, but they do the one over here. Also, as I whip off all my masks, like when I show my patients, is this kind of style. So this is what Kim is referring to when she's talking about nasal mask for anybody who's able to see the YouTube video on this topic. All right, Kim, take it away.
Yes. Okay, so if you're having a mouth leak that's resulting in dry mouth, the first thing you want to do is look at, are you breathing through your nose okay? So sometimes it happens because of just muscle relaxation and your jaw just relaxes, but other times it's happening because you're not breathing well through your nose. So you want to make sure that, if you need to use any nasal saline or nasal steroids, or talk to your provider about why you might not be breathing well through your nose. Sometimes people like to use like breathe right strips, or different sort of stents that can go in the nose to kind of help keep the nose open. But working on nasal breathing is one important part. Another
Question
thing
for you.
Yes,
Question
for
for you.
sure.
Sorry. Regarding actually learning how to nasal breathe, because some people, it's almost
Oh,
like a
yeah.
compensatory habit, right? Their jaw relaxes, they're gasping, they have this untreated sleep apnea for however many years they have it. They almost like, it's like one of those things, if you were suffocating, because that's the sensation that's happening, only you're asleep. What do? You sort of gasp your mouth open. And so they learn this behavior, but if they don't have a true obstruction of the nose or impediment for them to breathe, and it's really a habit, are there certain things that you talk about? Now, some people have talked about mouth taping, which can be a little controversial. My attitude about it is I think if it's during the day and you can control what's happening, you're not completely blocking off your airway, it can be useful because you can do it while you're watching TV or just some other things where you kind of get the sensation of really focusing on nasal breathing. But I wasn't sure if you had any other techniques or suggestions for folks that they can do during the daytime to sort of train them to hopefully improve what occurs when they're trying to be compliant at night.
Sure. There's a whole field that's called myofunctional therapy. And myofunctional therapists and airway specialists, they're a type of, occupational or physical therapist that works with people on learning how to retrain themselves to breathe through their nose. Our noses were designed for breathing. They filter air, they humidify the air naturally, and there's a lot of things kind of behind the scenes that happen that is important for our bodies from breathing through our nose. So people generally feel better when they do that. So talking to the myofunctional therapists, they have some tips online. I don't do myofunctional therapy specifically, but I know like some exercises include like keeping your tongue at the roof of, the front part of the roof of your mouth during the day. Certainly mouth tape, and we'll talk about the Somnaseal here in a minute. And that's another alternative for sort of blocking air to help train you. There's a water bottle out there called Remplenish. I don't know if you've heard of it, but
No.
I don't have one personally, but it has a specific straw that works on strengthening the airway muscles when you use the water bottle. So there's a number of different tips and tricks for that. And then there are, when we're talking about using a nasal CPAP, if you're having that dry mouth, sort of the traditional treatments in sleep medicine would include like a chin strap that holds your chin up, or of course like switching to a full face mask that blows air in through your nose and your mouth in case your mouth opens. The issues I have with those are that both the chin strap and the full face mask have a tendency to sort of pull your lower jaw backwards, especially if you're really tightening it down to eliminate any leaks because the full face masks are bigger. And so pretty much every day in my practice for the last 20 years, I've had someone who has come in and said, look, I really want to use these smaller nasal only masks, but my mouth keeps opening and it's drying out. And I tried the chin strap and it's uncomfortable because it's another strap and it doesn't actually seal the lips. It just, tries to keep your chin up. And so people may like sputter saliva or air through their lips, which is noisy and uncomfortable.
Lip farting. That's what
Yeah,
my
that's a
lips are
good name.
farting.
Haven't
That's a
heard
good
that one. So they're having that, or they're, just can't tolerate the full face masks. And so certainly that is where people started, doing mouth taping. I agree it's controversial, but for some people it does work. And so after having tons of, but then I had a patient one time saying, oh, I'm duct taping my mouth closed at night, and I realized the regular duct tape was tearing off my lip skin. And so I switched to the dollar store duct tape, but now I'm worried because I'm sort of drinking the adhesive chemicals at night. And what do you know about these adhesive chemicals in the dollar store duct tape? And I was
I
thinking,
can't
oh my
imagine they're
gosh.
good for you. Just spitballing
Exactly.
here.
They're not meant for ingestion. I do know that.
Wow.
And so that I had a patient strapping a maxi pad over her mouth at night to try to
Wow.
prevent air from leaking. And it was really at that point that I was like, okay, I've got to try to come up with a better solution. And so I got an innovation grant from my university, and I worked with some engineers, and we tried to come up with a different style of solution that was still going to be simple and comfortable and also affordable. So as a provider, like taking care of all of these patients, I don't like to tell them to go purchase something that's really expensive. And so I wanted to start with the simplest style first, and that was when we came up with the Somnaseal. So I'm showing it in the video here, but basically what it is it's a small piece of silicone that's very flexible and soft, and it fits inside your mouth. So I can just show you. There's a
And it's
little tab
reusable. You can
on the
clean it
front.
off and reuse
It's
it. So it's better for the
reusable,
environment.
exactly.
Okay.
And so you just rinse it off. The starter kit comes with like a little stand that can sit by your sink to let it air dry. And it has 3 different sizes: small, medium, and large. And so this is not a treatment for sleep apnea. This is something, it can be used by itself without a CPAP machine, but I really designed it it's a nasal breathing trainer. So it basically just forces you to breathe through your nose. So you want to make sure that you can breathe through your nose before you're using it. And if you're wearing a CPAP, even if you get stuffy during the night, that CPAP air will still get through. So it's not going to, stop your breathing or suffocate you. And I have different, sizes. This is the medium, which is just slightly larger. And that's because it's really hard to size online, because part of it depends on how much your mouth opens during the night. And one of its sort of key features is that it does allow your jaw to be relaxed. So a lot of people are dissatisfied with the sort of claustrophobic feeling of the chin strap, really tightly around their face. And as I was mentioning, that's not good for the jaw, TMJ anyway. And so with the Somnaseal, you can your jaw can relax a little bit, and it still blocks the air from coming out. So it allows people that do have the dry mouth or mouth breathing to use the sort of smaller, nasal only masks and be successful. There's a certain percentage of people whose mouths open really widely, and if they're doing that and they've got their CPAP on, then it will have a tendency to blow the Somnaseal out. And so with the starter kit, I do include just some like a starter package of X style tape that is not meant to seal the mouth. It's just meant to kind of keep the Somnaseal from falling out during the night. So I would say probably about 30% of people are using that with their Somnaseal. But otherwise, people just sort of pop it in, put their mask on, and that's it.
That is so cool. I am going to suggest that to some of my patients because I really think there are people with sensitive skin. Like you mentioned, just, either with regular tape or duct tape that you can get some skin irritation. But even if it's like made or designed to be something that you can stick on your skin, I mean, people have reactions to even simple stuff like Tegaderm, which is supposed to be about as hypoallergenic as you can get. So keeping that in mind, I think, is so key. So this is amazing.
And facial hair is no problem. So all of the
that's a
patients
good
with the
point.
beards that can't, tape doesn't stick well, the Somnaseal is an option. So in my opinion, it's a better option, but I designed this just to be a new tool in the toolbox for patients because, as you know, there's no one size fits all for any CPAP issue.
Oh, there isn't. Yeah. Personalized cares. We've been in this whole concept of personalized medicine is like, that's what sleep is. Like, it's really, really
Exactly.
personalized for everybody. So that's why when people are kind of nervous to invest in the time to work with folks like us, I'm like, do it because we really care about you and we need to get to know you in order for me to be able to help you. And,
Exactly.
you know, person A, like you said, is going to be very different than
Mm-hmm.
person B.
And sometimes it's just trial and error, you know, like we don't really know until you try something. And so having that sort of mental fortitude of getting this treated is worth it for me. And therefore, I'm going to continue to stick with it. Try not to get discouraged, understand that it's going to take some time. I would say the average time for patients to get sort of up to speed is 6 months with CPAP. So sometimes just knowing that going into it and not expect that, you know, the first night it's going to be amazing. There are people out there that do say, oh my gosh, I put it on and like, I haven't felt this good since high school. Like we all know these people and they get the press and then people see that and they think, oh, that's supposed to happen to me. That is more the exception than the rule. And so I always encourage people to, like, if you've got an issue or if there's, you know, something that's bothering you with your CPAP, somebody else has had that problem before. Let's work to find the solution. Just like, don't give up and let's focus on the goal, which is sort of living your most vital life.
So if I recall correctly, in sleep fellowship, we should joke about the rule of thirds. You know, there's always thirds, and I think asthma is one of them. And for this, in particular for sleep apnea, like a third of patients, I don't know, I just throw a mask and a machine at you and you figure it out, and it's like the greatest thing since sliced bread. But I
Exactly.
warn patients that there's another third of patients that will take up to 6 months to get better. Not everyone will be perfect, but we're trying to aim to get as many people to be on gold standard therapy, which is a machine at this point, CPAP or APAP, to help you with your breathing at night because it's just so successful. Yes, there are other modalities, and I do think that alternatives to PAP therapy are things that I have discussed before, particularly with collaboration with dental colleagues, and there's surgeries that can be considered. But what we're talking about is so key because so many of our patients will benefit from being able to be tolerant. And now, a quick break. But don't go anywhere. We'll be right back.
Struggling with sleep? Dr. Kole is here to help. Whether you need a comprehensive sleeping coach program, suspect you have sleep apnea, or simply seek a second opinion, she's available for consultations in New Jersey, New York, California, and Georgia, with more states coming soon. Schedule your free 15-minute consultation today to find out which visit is right for you at askthesleepmd.com and start your journey to better sleep with a trusted physician.
If you are liking this podcast, if you're finding it educational, if you are feeling more empowered to go to your doctor with any sleep issues that you might be having to address them, please, please, please lend your support. Make sure that you are liking, following, subscribing. I am available on YouTube. I'm also on Apple, Spotify, or wherever you get your favorite podcasts. The website has launched. So we have askthesleepmd.com to be your free educational resource. We've added many new blog posts filled with juicy information. If you would like to support the podcast, we now have a way for you to donate. This is a labor of love. I truly enjoy what I am doing. It would be inspiring and truly helpful if you wouldn't mind even so much as donating $1 to keep this podcast going, particularly if you really find this free education a good platform for you and a good resource for you. I also have affiliate links for products that I'm a proponent of, such as Quiet Mind. So please check out the website, sign up, and you will get the latest news, the latest blogs, some sleep tips, and just have a great day and keep listening. Okay, guys, sleep well. Kim,
Exactly.
you had mentioned about nasal masks, and we know that the literature supports that basically if you have less tchotchke on your face, you're more likely to be compliant. So the more you have going on, the less likely. And in part, it's related to mask leaks. So let's segue into mask leaks and some of the suggestions you have for that. I'm going to grab some full face masks to show some folks.
Okay, for sure. So mask leaks is probably up there with dry mouth as one of the top complaints and reasons why people give up on their CPAP machines. But there are some things that we can do. So the full face masks are the ones that we just talked about, go over your nose and your mouth. And those do tend to have more leaks just because there's more surface area for it to leak. If you absolutely need a full face mask, however, and there are people out there that do feel most comfortable with a full face mask, they have a couple of different masks that have, I think AirFit is one of them, that has a memory foam cushion. And so if you're having a lot of air leaks, sometimes a memory foam can just help get there you go.
Memory foam. Okay, so
yeah.
This is different, just as Kim was pointing out. Just for a little, you have your full sort of like silicone type material, and then you have the one with the foam, just to show you guys a visual, okay?
Yes, and that cushion, needs to be replaced regularly. It's not quite as easy to clean, but it does sort of, everybody's face is different. And so we have, maybe 3 sizes, if we're lucky, of these masks. So it isn't practical or realistic to think that those sizes are going to fit all the faces. So memory foam can help sort of mold to your face a little bit. There's also, there's mask liners that I think are pretty popular and can work well. They have, the mask liner you would want to get the liner that would fit your mask. And a lot of the times it's just a piece of cotton or fabric that goes between your mask and your face. And that helps, again, if there's just like over here by your nose, there's a little hole always that's blowing air into your eyes. The mask liner can sort of plug that hole, so to speak. It can also help to keep the mask from sliding around as much, or if it feels like it slides around too much, sometimes it can be enough to sort of help keep it in place. So my favorite mask liner solution is something called Pad-a-Cheek. And, if we talk more about sort of having pads on your straps to keep from having strap marks, they also sell those. That's why it's called Pad-a-Cheek. But they have, they sew specific liners for pretty much every type of mask. There's also one called REMZZ, REMZZZ, and that's a very good one, just a small piece of cotton. And then there are a number of other ones that are, the REMZZs are sort of, 1 or 2 night use, so they're kind of more disposable, but that does make it easier to sort of clean, keep things hygienic. But they do have some that are sewn and are reusable that you can use, on your mask to just sort of block those leaks.
I was just going to add to that, I agree with you. I really have had very good success with the Pad-a-Cheek brand. I think they're doing a bang-up job with that. And plus, for folks that are really environmentally conscious, they like the idea of I can kind of wash something off and then I could reuse it a bit. I don't have to necessarily dispose of it. REMZZs I've also used for sure. My biggest criticism with them is when they do work, one of the things I hate is it almost feels like it doesn't really stay on the mask. You have to sort of place it and situate it in a way, and then you have to make sure you now
really fast get it up there.
Yeah. So they do make something, I don't know if they're still manufacturing, but there's a couple of other brands. There's the Silent Night that I've used. Those
great.
actually will stick. So it's cloth. And they say it's for about a week, but I got to tell you, if I had to use a CPAP mask, there's no way that's going a week. I would easily dispose of that sooner. But it has little stickers on it. So at least it's sort of like REMZZs with stickers, if you will.
Okay.
Yeah,
I haven't heard of that. That's awesome.
Yeah, and then you had actually mentioned something called the Gecko nasal pad. So can you tell people about that? Because I think that's also really helpful, especially for people with issues around here of the bridge of the nose or just sort of irritation from the mask, even if it's not necessarily a leak.
Yeah. So the Gecko nasal pad is it looks a little bit like like it has kind of wings, and it goes over your nasal bridge and you set the mask on top of it. So that is helpful if you're having leaks up there. You might be getting dry eyes during the night because it might be blowing into your eyes, and that Gecko pad can help to block those leaks. Or if you just have irritation or redness or skin breakdown over the bridge of your nose, because there's a lot of pressure at that point when you're wearing a full face mask. And so the Gecko nasal pad can just act as like a cushion and protect your skin. If you're, they're pretty easy to get, and they're sticky and reusable. But you can also just like put a Band-Aid there over your nasal bridge too, like anything that gives just like a little bit of cushion. The goal is to try different things to where it's comfortable and it's not leaking. If there's like a little bit of leak that shows up on your, leak on your machine, if it's not bothering you or a bed partner and your residual AHI and everything looks good and you're happy, then I'm happy. I want CPAP to work for people, and I want it to be like a positive part of your life. And so I discourage sort of micromanaging some of these numbers where it's like, my leak was 12, last night, and tonight it's 6. Like, what did I do differently? And it's probably, there isn't a big like life difference in that 12 and 6 if you feel well and if you're following your other numbers and your residual AHI looks good.
And that sounds like it's pretty acceptable within the mask leak range, just under 25, what have
Right.
you, right?
Right.
So I am going to actually show an oldie bookity. Look at this, like this thing that looks like a giant monstrosity. I'm bringing up, this is a very old, I think it's called the Mirage Quattro. It's written somewhere, and I need reading glasses. It's not bright enough in here to see that. But the reason I'm demonstrating this is because sometimes the ones that look like you're wearing a freaking helmet are actually wonderful for you, because even if it has a bar on top, that's also, we're showing you the newer styles because they're kind of less on the face, have been really popular, but sometimes that causes a little bit of destabilization around where the bridge of the nose is. And so sometimes having something, even if it's a little bulkier, to kind of, I just have patients that are really sort of married to that still. They really like an older style design. Yeah. And then neither one of us has real personal experience with this, but I've had folks come to my office and talk to me about it. So I'm going to briefly mention the fact that there is some technology out there. There are a few companies out there that are trying to do some virtual mask fittings. To be honest with you, I leave those to the DME company. I used to do a lot of that in my office. Part of the issue for me is just I know that people need to pay for the technology that they have, but it can be quite expensive in a situation where we're trying to optimize patient care, but with very, very limited budget and reimbursement. So there's not a whole lot of wiggle room. So I leave it to the people who have the volume, if you will, to manage that. But when you're talking to your DME provider, they may actually start to utilize some of those tools, looking at your face structure and trying to predict what might work better for you in terms of mask styles, because there's so many brands out there that could possibly work.
Exactly. And, as I mentioned, I was just at the Sleep Medicine Trends meeting last weekend, and they did talk about these sort of AI virtual mask, face scanning type software to predict masks. And it looks like there's some pretty good data that people are more successful. You put in your height, weight, and as far as mouth breathing and things like that. I just think there's, it's probably pretty good. And if it works, then that, may be a success for some patients. But as we mentioned before, there's no one size fits all. And sometimes it takes just talking to someone. I would hate for someone to say, yes, I'm a mouth breather, and then a computer program tells them, oh, well, then you automatically need a full face mask.
That's true.
That's not true.
Right. That happens.
The nasal mask is more comfortable. Data suggests people are more successful with it. It's lower profile, smaller, and we're meant to breathe through our noses. So there's, that's my concern with just using a computer program. But that being said, I think that there are fewer mask exchanges, and with more data coming out over the next couple of years, and it becoming more commonplace, maybe the price will come down.
Exactly. That's the other factor too, is the more times people get comfortable with it, the cheaper it becomes, which is awesome. I want to talk about Rainout next, because that is kind of really tricky. And I also think it's one of those phenomenon that I saw less of when I was training in California and everything is sort of the same temperature all year long. And then I come to
Right.
Jersey and there was a lot more complaints about the rain out and just, between forced hot air and, air conditioning and all sorts of other things because we have such a big season. We have all 4 seasons out here. So it's
Yeah.
great. But the flip side is I get a lot more questions and issues about Rainout. So can you describe to everybody what that is and what are your sort of tips for improving that?
Sure. So rainout is something that occurs when there's water condensation in the tube and it starts to drip on your nose. So a little bit of rainout can be just mild annoyance or maybe like a little bit of itchy feeling, discomfort, but significant rainout can actually like drip water in your nose and make you feel kind of panicky, and really unhappy. So it happens because of this, there's humidification in your CPAP machine. And we want that because this air that's blowing through your nose, it dries out your nose. And as I mentioned, even though our noses are built to humidify the air, that's not just a force of regular breathing. So when we start blowing it, it's like having a fan, blowing into your nose. And so that's going to tend to dry out your nasal passages and even, your throat and your mouth, as we mentioned, if you're opening your mouth. So we came up with humidifying the air that's being blown and that humidification you can dial that up or down as far as if you want more or less. And it's also warm, because we like warm, moist air is more comfortable. But as that air travels through the tube to get to your nose, it tends to cool. And so warm air holds more moisture than cool air does. And that's just back to, I guess that's physics, or maybe chemistry, who knows? So back to our, science equations where as the air cools, then water is going to condense and turn from being sort of vapor into moisture or vapor into being actual condensed water droplets. And so that is what is causing the dripping onto your nose. So the key to making this not happen is keeping that air warm. So that's we can talk about different ways to do this, but what you want to do is keep the air from getting cold. That's going to keep it from condensing into water droplets as it travels from the machine to your face. So the number one thing, and something that's pretty standard now, is to have a heated tube. And you would ask your DME company for the heated tube. There is a slight extra expense, but I believe it's reimbursable. So, but you may have to ask, depending on your DME, for that heated tube. And then most of the machines will just sort of auto heat that tube for you. So that's the number one. If it's still happening and you have the heated tube or you don't have a way of getting a heated tube, then you can get a tube cover. They have like fleece tube covers. There's additional benefits from that, like if you've got any animals that like to chew on your tube or anything, having these tube covers just sort of protect the tube, but they also keep the air traveling through there a little bit warmer. So that's another option. A third option is you can put like a blanket or something over the tube. If you're on your back and the tube's going across your chest, if you put a blanket over it, sometimes that helps to keep it warmer. If you have a fan, I know I like to sleep with the fan on. I can hardly sleep without it. But if you have a really cold room or a fan that's blowing on you, that's also going to cool the tube. So directing that fan like away from your body or covering up the tube in some way so that the fan's not also cooling the tube can be helpful. So those are 3 different ways of keeping the moisture warm, keeping the air warm as it travels. You can also turn down the humidity. So, an average humidity level is about 3 to 4, but you could try maybe 2 would be enough for you. And then the last trick I would say would be you can try putting your PAP machine lower than your bed. So if
Worst
you,
case scenario, just use gravity. Keep
yes,
more
use
to water.
gravity, and you can, it can sit at a chair, or something next to the bed or on like a little stool down low. And then that helps that water to sort of fall back down into the machine instead of on your nose. So that doesn't work as well if there's like a horizontal component, if you're facing the other direction and the air is, coming across your body and into your machine. But that is something that can be helpful instead of having the machine at, your same level, like on a bedside table.
Awesome.
So,
And I
yeah.
also wanted to ask you one final thing as we wrap up, because I do think we have a couple minutes to spare for that, which is really talking about the sensation of the pressure being strong. So I wanted to make sure we touched on that because I think it's one of the bigger problems. And one of the things we've talked about offline that you had mentioned in the notes is that when we're delivering pressure, one of the interesting things is when we're setting the pressure, it's the pressure in to help open the upper airway tissue. So that's the inspiratory pressure. And typically the pressure going in, and when you exhale, you're exhaling against that exact same pressure. What's very fascinating to me is when I started transitioning more to like a telemedicine practice and I do a bit of moonlighting for a company, one of their mandates was that everyone have a feature called the expiratory pressure release on to start. And what was fascinating with me is I actually did the opposite in clinical practice because I would have patients who did not like this expiratory pressure release sort of setting that you could add, and they actually found that more uncomfortable. So I was curious if you could kind of explain that to folks, and also what was your clinical experience with it? Because I've just had mixed reviews with it. I'm doing the protocol and kind of leaving it up to respiratory therapists for this particular company, but it hasn't always worked out to use it. So
I don't like the EPR very much. I think that our thoughts about CPAP are and the inspiratory and expiratory pressure and which one of those is the most important for keeping the airway open is sort of coming into question. So traditionally, it's always been the inspiratory pressure, but more recently, it's looking like, if you study the physics of it, that the expiratory pressure is actually quite important at maintaining that patency or openness of your airway. And so when the pressure drops down, yes, that can be more comfortable for people because they feel a little bit of that relief as they're trying to exhale. But what that may mean is that the overall pressure needs to be higher in order to maintain treatment of your sleep apnea. So it's a lengthy conversation about the physics and the background of this, but one tool that is gaining some traction and sounds really promising and interesting is this VCOM. And so what that does is you put that in between your hose and your machine, or it goes between your mask, like at the mask end, between your mask and your hose. And that tends to, they call it sort of training
something
wheels.
like this, right? So you take this, put it like this, and then so guys, I'm just connecting it to a mask, and then you'd have your hose at the end of it.
Exactly. And so research is ongoing with this, but it's considered training wheels for CPAP. And so it is available without a prescription. People can buy it online. I think it's about $35. And it's specifically intended for people that are struggling with the force of the pressure. The pressure seems too strong for them. I will say other things that you can do for that is talk to your provider about maybe lowering the setting. So I think people think, this is my pressure, this is what is set, and the DME companies will reinforce this, which is there's no changing that. That's your prescription. But as you're adjusting to wearing CPAP, your provider, I know I am, may be willing to lower the pressure a little bit in order for you to get started. And then once you're comfortable and you're tolerating it better, then we're going back to increasing the pressure to what we know is going to be adequate for you. And you may have some breakthrough apneas if the pressure is too low, but I'm willing to give that up in order for someone to be in agreement with their machine and to like it and to not dread going to bed every night. And this is we both have the same goal, which is ultimately to feel better and get the sleep apnea treated. So if you have a conversation, there may be wiggle room with your machine. There may not, but it might be worth asking if that's the case. And then if not, you can try, the thing to do if you're wondering about this EPR being, an option for you, that is something that patients can control. So you can adjust that EPR to be off 1, 2, I think some of them have a 3. Mm-hmm. And so, if you wanted to try it one night on a 3 and try it the next night on a 0 and look at your numbers and think of, consider how comfortable you were with the machine, that is perfectly fine. So, again, use of your machine, comfort with your machine, feeling good in the morning and feeling good during the day. That is my goal for people. And it's personalized and we'll work through the problems.
Again, personalized medicine. We are here to help you guys. So, Kim, thank you so much for sharing your wisdom. This is a smart cookie. She can really help you with your CPAP issues. So check out our website. It's KimberlyMD.com. And, if you're looking for a new gadget that's not tape to help you with any leaks and you want to try to avoid the chin strap, consider the Somnaseal.
Yep.
So this has been really fun, Kim, and it's such a pleasure to connect with you. And keep it up, what you're doing, the good work, okay?
Yeah, well, thanks for having me, and thanks for having this podcast for people. Let's get the word out.
Absolutely.
Disclaimer. The statements made on this podcast have not been evaluated by the U.S. Food or Drug Administration. They are not intended to diagnose, treat, cure, or prevent disease. The information provided by this podcast should not be used as individual medical advice. While I am a practicing sleep provider, I am not your sleep provider. You should always consult with your personal healthcare provider for individual recommendations and treatment.